Okay, so today we are going to discuss the structure of a lymph node and the lymphatic flow through it. So, once for all, this is you can see this is the structure of a lymph node, which is uh, basically it's a cross section. So, we can see here this is the outer capsule, and these are the efferent channels, or efferent lymph nodes, lymphatic channels, lymph vessels, efferent lymph vessels, and these are the efferent lymph vessel, efferent. Okay, this is the vein and this is the artery. Okay, so before going to the lymphatic flow, quickly we go through the structures. So these are the efferent vessels and these are the efferent vessel. There is a subcapsular space. This is the subcapsular space, as you can see, and then we have the superficial or the outer cortical area. This is the superficial or outer cortical area, and then we have the deeper cortical area here. Here you can say the deeper cortical area, and then we have the medullary sinus. This area is the medullary sinus. Okay, and these are the follicles, and these are the germinal centers, as you can see here. Okay, so uh, as you know, the lymph node will receive the lymph through the efferent channels. Where? Through the efferent channel. So lymph come to the lymph node through these uh, efferent channels. Then it comes to the subcapsular area. And here we have the dendritic cells. Dendritic cells are involved in the initiation of immune response. Okay, it's a meshwork of reticular fibers, macrophages, and dendritic cells are here. Then we come to the next outer cortex. So the outer cortex here, this area, the outer cortex contains the B cells within the germinal centers. Here these are the follicles, and these here the germinal center. Here we have the B cells. Then we have the deeper cortex here, and the deeper cortex contain the lymph sinuses, and it contains the T cells. Then we have the medullary sinuses, and the medullary sinuses will have contain the plasma cells and the B cells. Okay, so lymph will come here. Then after the efferent vessels will take it out of the lymph node to the lymph vessels, and then it will meet ultimately in the to the veins. So this is a short because I was finding it a bit harder when it comes to the places like where is the plasma cell, where the T cells, where the germinal center sometimes. So, and like as we are discussing this lymph node, so we can quickly discuss the different types of follicular hyperplasias or the lymph node enlargement. So lymph node enlargement always occur by is always of three types, or it occurs by three methods. The follicular hyperplasia, as we discussed here, these follicles enlarge. Okay, so these follicles enlarge, and there is continuous production of B cells, and so that's why when these are enlarged, so we say that these are due to follicular enlargement. So why this occurs? This occurs in collagen vascular disease, rheumatoid arthritis, systemic toxoplasmosis, syphilis, and HIV. Okay, and then the other method is parafollicular or interfollicular hyperplasia. So this is because of the T cells, and where are the T cells? T cells are on the deeper cortical region. So this is actually the paracortical. Uh, this is actually the paracortical interfollicular region. So hyperplasia of this region will be in in viral infections, infection mononuclear Epstein-Barr virus, certain vaccination, smallpox, and immune reaction induced by certain drugs. So such lymph node enlargement will be due to paracortical, and in these cases. And the last case is the sinus histiocytosis. This is reticular hyperplasia, distension and prominence of the lymphatic sinusoids. So lymphatic sinusoids or lymphatic channels enlargement, this is more of the structural enlargement due to marked hypertrophy of the lining endothelial cells. तो ये कहाँ से होता है? ये जो हमारे पास lymph nodes में डिफरेंट यहाँ पे जो चैनल्स है, lymphatic channels, नॉट lymphatic channels, बल्कि lymph nodes में जो हमारे पास साइनोसाइड्स बने है, medullary, not medullary sinus, but the meshwork. See here, the afferent vessel delivered lymph nodes to a subcapsular meshwork of reticular fibers, macrophagy, and so these. Here we have the wait. Here we have the here we have the lymphatic sinusoids. So actually these sinusoid enlargement, these are basically like the vessels, endothelial cells or endothelial lining cells. So these enlargement will cause the overall enlargement of the lymph nodes, and it will be because of lymph node draining the cancers and immune response to tumors or its products. So this is sinus histiocytosis, which is also called reticular hyperplasia. So these are the three methods by which lymph node enlargement occur, and this is one of the question in this station. They ask about it, about the different mechanisms. Thank you.